Who gets to decide what is reasonable and what is unreasonable? Do you think that people are likely to agree on that or disagree? Do you think that values are at play when we decide if something is reasonable or not? Quality of life. Who gets to decide what is a good quality of life? How widely that varies between different people with different sets of values. Balancing in what direction, and how much weight do we give on competing considerations? And personal growth. Different people will mean different things by that. It's a value-laden term. So we can see here that the dignity of risk principle is replete with value-laden language. Let's try to unpack things in a bit more detail by very briefly looking at the history and then the etymology of this term dignity of risk. It actually was first written about in this paper by Robert Persk. Robert Persk was a theologian and advocate for people with intellectual disabilities. Now, obviously, the language is somewhat dated here, and it's not language that we would use now, but the paper is The Dignity of Risk and the Mentally Retarded. And in 1972, Persk wrote this: "Overprotection endangers the retarded person's human dignity and tends to keep him from experiencing the normal taking of risks in life, which is necessary for normal human growth and development." The concept of dignity of risk was subsequently picked up by Patricia Deegan, who was at the heart of the independent living movement and the recovery movement in the deinstitutionalization era. She stated, "By reclaiming the dignity of risk and the right to failure," which is obviously a closely allied concept, "as well as the right to try and succeed, people can leave institutions, make their own choices, and live independently." So taking back control was the name of the paper, taking back control over our own lives. And so very much Deegan was here promulgating the role of autonomy and the value of autonomous choice making for people living with mental illness. Let's now look at the semantics. What does dignity mean? It's a commonly used word, but not necessarily straightforward. It's a bit like that term shame that we throw about in mental health without being entirely clear what we mean by it. So what's meant by dignity? Let's have a look at the dictionaries. The Macquarie: relative standing in respect of other people or other things. Rank: the importance and value that a person has that makes other people respect them or makes them respect themselves. So there was something here about status, about power and responsibility. And the dignity of risk principle is making some kind of claim about those things in the context of the Mental Health and Wellbeing Act. To the extent that a person's autonomous choice is taken away from them, that they are deprived of that, there is a risk that status is lost, that they are reduced, the level of respect that they were afforded is reduced, and there is a loss of dignity. The corollary of that is that by promoting dignity, by allowing people choices, by allowing them to fail sometimes, ultimately their social status is enhanced to a point of equality. We support autonomous choice and we empower patients. So the key word here is power. Now, all well and good. But as Churchill pointed out, and he's not the only one who said very similar things, where there is great power, there is great responsibility. Where there's less power, there's less responsibility. And where there is no power, there can, I think, be no responsibility. So this correlation between power and responsibility which I think is absolutely central to our work. Essentially, what flows from that is, to the extent that we are empowering patients to give them the dignity of risk and make their own choices, we are also handing over responsibility.